The reason why we can get our patients better in a week is because we push the brain very hard in all different areas. It's almost like, trying to fix a whole system, trying to fix a clock by taking one cog out and putting it back into a broken clock. You got to fix the entire clock. And so that's what we do. We look at the brain as a whole and we take all the pieces and we fix each piece and make sure that it goes back into a network that's also working. The scan looks at almost 60 different regions of the brain, and we can see which areas are hyperactivating or working too hard and compensating for other areas that might not be working hard enough. And we are able to balance those areas out depending on our treatment. With the patient themselves, they become part of the team. The patient works, I would say, just as hard, if not harder, than the therapists, because I often say, we set up the program, you still have to do it. So full participation, full motivation is an inherent part of this process.
This program requires effort on their part. It's active rehabilitation. And so, and it's also a positive attitude. And I don't fault most of the people who come here because they've usually been through a lot. They've been through everything. They've been through all kinds of treatments that haven't worked. This place is often a place of last resort. So they come in skeptical. So you see people Monday morning, you get a whole group in and they're grumpy and skeptical and not feeling well. And so it's important to give them that confidence to say that you will get better, and it's totally doable. It's not a miracle. People call it feels like a miracle, and people use that word, but it's really not at all a miracle. It's just doing what we do really well and understanding the brain and fixing it. You give that initial push, and that's what goes on here, is that initial push, and then maintaining that. The brain will continue to heal, but the real healing will happen, in the weeks and months that follow leaving here. So it's important to keep up with the regimens and let that healing solidify.